To measure metacarpophalangeal abduction range of motion using a goniometer, the patient is seated with the forearm pronated. The upper extremity is supported on the table, and the wrist and hand are in a neutral position. During the measurement, the axis of the goniometer is aligned with the dorsum of the metacarpophalangeal joint to be tested. The stationary arm is aligned with the dorsal midline of the metacarpal, and the moving arm is aligned with the dorsal midline of the proximal phalanx.
Mr. Jones, I'm going to measure how much your finger moves out to the side using this device. When I ask you to, I want you to move your finger out to the side like this and hold it there. Now move your finger out to the side, hold it there,